Hi, sir. The topic of our group is drug abuse. Our group members are Agnes Tan Jieying, Zhou Jie, Cheng Wenjing, Chen Xinwei, Tan Wenxuan, Chong Wenxian, and Wang Xinye. I will introduce drug abuse. Drug abuse refers to the excessive or improper use of drugs, including prescription drugs, illegal substances, and center over-the-counter medication. It can lead to physical and psychological dependence, affecting daily life, work, and relationship. According to WHO and the UNODC, around 275 million people worldwide use drugs in the 2020, with opioid-related deaths doubling over the past decade. The opioid crisis in North America is worsening. Cocaine use is rising in Europe. Social media and peer pressure are major contribution factors. Drug abuse is linked to physical, social, and environmental factors and can cause several health issues such as liver damage, heart disease, nervous system disorder, and even death. It also leads to higher crime rates, family breakdowns, and economic burdens on society. In conclusion, drug abuse harms both individual and society. Education, prevention, and treatment are key to reducing its impact. About the objective of the report. First, we aim to raise public awareness and increase social attention by highlighting the harm, causes, and effects of drug abuse. Second, we will examine the weakness in current drug prevention policies, provide data support, and help improve laws and government measures. Finally, we will explore the psychology, social, and economic costs of drug abuse using data and cause studies to show its complexity and impact on individual and society.
So now I will continue with the part of 3.0 definition. So actually drug abuse is mean that someone is using the medicine either in the illegal way or with an excessive amount, which can cause damage to their body either in physically or mentally. So actually drug abuse also have another name called as substance abuse, which means that the usage of certain chemical substance and that can cause addiction if eat a lot. Actually, drug abuse got another name also, which is chronic relapsing disease, which drug abuse can recover after recover it can back again if means that it's a long-term effect in and may relapse again. The next I'm going to talk about is the 4.0 cause of drug abuse. There are actually few causes, which I will talk about. The first one is the environment cause. The first environment cause is because of peer influence, which mostly will happen in the young adult game, as they want to fit in, like join the other people game, so they are trying to ascend with others. And the next is because of the family, especially to the parents. The parents have a habit on the drug abuse, which may make the young adult think that the drug abuse is actually acceptable and without guidance from the family. The next is the environment of easily get the drug in their surrounding, which can increase them exposed to the drug abuse. The last one is the culture and media, which make them will think that drug abuse is actually socially acceptable. And media actually also indirectly promote that the drug abuse in the any like as a sign of freedom or the social standing. The next one is 4.0, the psychology course, which the first one is the main for the psychology course is because of the stress. Usually is the individual they cannot cope with the stress, so they want to release their stress with the drugs. And the next is usually happen in the young adult, which they were being curious to the something they never tried before, so they want to try it. So the end will cause the drug abuse. The third is the individual lack of belonging or feeling out of place in society, which is like they are feeling lonely, alone, like always themselves on it. The last one is the mental disaster, like the depression, anxiety, and others, which can cause them like usually turn into the drug abuse. The last cause I'm going to talk about is the others cause, which the first for the others cause is the lack of awareness and education for the drug abuse, which actually will mostly happen in the young adult as there are lack of awareness of the risk and also the effect of the drug abuse. The next is the overuse of the medicine can cause also the drug abuse. As for some patients, they are improperly take the medicine and the end the medicine will turn into the drugs and cause the addiction to them. The third one is the economic problem which can cause the highly unemployment rate, and for those unemployed people they will try to release the stress with the drugs. The last one is the unstable economy, which can cause the increased illegal drug market and lead to the drug abuse. As the people, those are unemployed, they will try to involve themselves in the drug trafficking to try to earn money for their life.
Of drug abuse in Malaysia, drug kills and anxiety and the depression sharing needles spreads dangerous diseases like HIV and hepatitis. In Malaysia, methamphetamine is the main reason for mental illness. The government spends Rm 500 million every year on drugs problems. Companies less money because workers miss work or cannot work well. 16% of violent crimes involve drugs. Many crimes happen in the poor areas. Drugs users steal to buy drugs. About family impact. Children of drug users feel sad and scared. They may use drugs in the future. Families break apart because of drug abuse. The number of drug users increased from 130,000 to 170,000 in 5 years. 65% of drug users are young people. Students and youth. More students use drugs now. 11,000 students were catch in 2023. The reason are stress, peer pressure, and family problems. 55,000 people enjoyed rehab in 2023, but many start to use drugs again. Family and community support can help them stay clean. Drugs abuse is a big problem. It hurts health, family, and the society. Prevention and the support can help solve this problem.
We started with the issue of cocaine trafficking in Europe. This is a growing concern due to the increasing demand for cocaine and its smuggling from South America. Traffickers use strategic routes, mainly through the Caribbean of West Africa, to bring large amounts of cocaine into Europe. This had led to a public health crisis as cocaine use of addiction rates rise, along with violence from criminal groups competing for control. Economically, the situation puts a strain on law enforcement and healthcare resources. Solutions to this include international cooperation to disrupt trafficking networks, better border controls, and public education campaigns to reduce demand. While Malaysia isn't a major cocaine destination, authorities have seized 31.44 kg of cocaine between 2021 and 2023. This highlights that the issue is global even in countries with lower demands like Malaysia. So for the second one, I will be talking about the DHS agent in Utah selling seized bath salts drugs. Two DHS agents in Utah were accused of selling bath salts, drugs seized during investigations. Their greed led to a significant amount of profit between $195,000 and $300,000. This case raises serious concern about oversight as it showed that the seized evidence wasn't properly managed. The consequences include a loss of public trust in the justice system, increased availability of drugs, and compromised legal proceedings. To prevent such issues, we need better oversight, regular audits, and stronger ethics training for law enforcement. In Malaysia, drug use has declined by 9.8%. Maintaining public trust and effective drug control relies on holding law enforcement accountable.
For the third article that we refer is an academic journal. This article in the Journal of Academic Research focus on the issue of drug abuse among youth in Malaysia. Drug abuse is a significant global concern impacting both individual and society. Since year 1970, the Malaysian government has classified drug as the nation number one enemy. Between 2010 and 2016, over 130,000 drug abusers were registered, with nearly 9,000 aged 90 and below. The most common abuse drug among youth is methamphetamine. The cause of the issue is peer pressure, curiosity, and stress. Unfortunately, this leads to serious health consequences, academic failure, criminal behavior, and financial burden. To solve this, solutions include parental involvement, school-based prevention, community effort, and government intervention. Next, shifting our focus to another critical issue, massive drug seizures across Malaysia. According to a report from Malay Mail, between March 2024 and February 16, 2025, Malaysia authorities seized a staggering 102 tons of drug, valued at 1.67 billion ringgit. Once again, methamphetamine made up the largest portion, with nearly 40,000 kg confiscated. This crackdown led to the dismantling of 219 drug syndicates and the arrest of 675 individuals, including 4 chemists directly involved in drug production. This cause that drives drug trafficking is because of economic incentive, poverty, and unemployment and lack border control. The consequences, however, are devastating. Higher crime rates, social instability, and increased youth vulnerability. To combat this ongoing crisis, authorities have stronger law enforcement, rehabilitation programs, and economic support to prevent drug-related
7.5 Drug abuse in Malaysia. The definition will be by WHO as harmful use of psychoactive substances, cover illegal narcotics prescription and over-the-country pharmaceuticals, and can result in dependency, causing psychological behavior and cognitive symptoms. So the status in the Malaysia will be increased from 128,911 in 2023 to 169,691 in 2024, a 31.6% increase in 1 year. The largest number of cases affect people are from age 19 to 33. So the highest drug addiction rates in Malaysia stage are Kedah, Terengganu, and Kelantan. So what caused about this teenager aged from 19 to 39 that have drugs abuse? So first one will be the peer pressure, stressful life event, parental neglect, psychological and biological factors. So the effect when they take this drug abuse, the effect they have is health issue. The health issue is including the heart problems, liver damage, mental disorders, and transmission of infection disease. The second effect will be the productivity loss, which means from addiction worsen economic burden. Lastly will be the criminal activity, will be used for criminal activity like to do like fun addiction. So the solution we can provide in the research will be increase the public understanding of drug user rise, especially among the teenager population, and also increase the law enforcement efforts to curb drug trafficking and smuggling. Second will be 7.6 drug abuse in the artistic community. So this news will be about regular using of chemical altering method stage, also like including the alcohol, prescription drugs, illegal narcotics, and also can negatively impact relationship, health, and professional obligations. So stated in the Malaysia in 2020, 13,900 new drug abuse cases were recorded in Malaysia. So drug addiction affect 19,669 men and 974 women. So this one is addressing this require policy, reform, mental health assistance, and education. So what caused about them, like for the artists to have this drug abuse, which is the subcultures, mental health issues, maybe like the cyberbully, and also mental health issue and the creativity. So this will affect them likely to the health issue, which is I mentioned before, the heart disease, the liver damage, and also economic burdens. Furthermore, and also will be like the decline in cultural heritage due to the premature deaths of gift artists. So the solution will be implement program educating artists on drugs danger and promoting healthy coping strategy. So maybe we can invite artists to have this drug danger, talking about like avoid it, and also the second will be the promote peer-to-peer support through support the group. So which means those who like didn't go through about this drugs abuse, we can have a peer counselor to guide them.
So now let us move to the analyze the issue with social science theory related to the topic. So several social science theories, including strength theory, conflict theory, and routine activities theory, help explain drug-related corruption in law enforcement. For the first one is strength theory by Robert Merton, suggests that when resources are insufficient to achieve social goals, individuals may resort to deviance. Utah DHS agents selling seized drugs may be driven by greed and financial pressure, choosing corruption over legal earnings, which fuels illegal drug activities. And for the second one is conflict theory by Karl Marx, argues that the powerful exploit resources for personal gain. In Utah, officers prioritize profit over duty, worsening drug issues and eroding trust, depending social frustration and institutional distrust. And for the last one is routine activities theory, links crime to offenders, targets, and weak oversight. Financial incentive drive DHS agents to often seize drugs are targets and lax supervision enable corruption. Stronger oversight and penalties are key to prevention. So now in conclusion, drug abuse poses several threats to society, the economy and the public health, leading to increased crime, economic instability, family breakdowns, and rising healthcare costs. The growing use of opioids, cocaine, and synthetic drugs further exacerbates the issue, causing life-threatening health risks such as organ failure, heart disease, and further overdoses. Addressing these crises require a multifaceted approach, including raising awareness, threat education, enforcing stricter drug laws, and providing rehabilitation programs for affected individuals. Strengthening policies and promoting global cooperation are essential in the fight against drug abuse, ensuring a safer and healthier future for all. That's all. Thank you.